2012 Soane's Innovation Award. Developments in endovascular surgical devices and techniques. Dr. Roy Greenberg.
In 1999, when I came to the Cleveland Clinic, one of my goals was to start a lab where we would develop technologies that would allow us to go into the branches of the arteries. And people laughed at that. But our first case was 2001, and then that's just kind of blossomed since then.
Dr. Roy Greenberg pioneered the field of endovascular strategies and instruments to treat complex aortic disease. He holds more than 50 patents on endograft devices developed from his research and serves as National Principal Investigator for the FDA on clinical studies focused on aortic aneurysms.
Roy looks at things and thinks about things in ways the rest of us don't. There's no other person I know of who has that kind of thought process to get things from his mind into patient usage and have patients really benefit from his innovation.
Working collaboratively with cardiothoracic surgery, radiology, and cardiovascular medicine, Dr. Greenberg's groundbreaking research and innovative devices have benefited patients throughout the world.
He invented ways to make endografting much more applicable to people with complex aortic disease and made it very possible for many patients that couldn't have been treated before to have successful outcomes.
Greenberg helped create 3D navigation techniques that virtually eliminate the need for contrast dyes, thereby limiting radiation exposure. He designed modeling technology for a 3D printer, which makes custom grafts for patients with complex arterial problems.
Roy is a clinician and he's an engineer, and it's really the melding of those two things that has allowed him to really push forward the field of endografting for complex aortic disease.
We've taken an area where there's been 10 to 20% mortality from procedures and brought the risk of death down to below 2% or 1% in some cases. We'll never be perfect with how we treat patients, but we have to be as close as possible.
Roy is, first of all, a humanistic physician, as Dr. Soane's was. He is an outstanding clinician, as Dr. Soane's was, and he is tremendously innovative, as Dr. Soane's was. And this ability to apply advances in technology directly to patient care was really the Mason-Soane's tradition, and that is what Roy has exemplified.